Welcome to our exploration of the biomechanics of human skeletal articulations. Today we'll focus on common joint injuries and pathologies, a crucial topic for anyone interested in movement science, physical therapy, or sports medicine. Understanding how joints function and what can go wrong is essential for preventing injuries and promoting long-term joint health. We'll walk through the most frequent joint issues, their causes, symptoms, and implications for flexibility and movement. Let's begin by examining the nature of joint injuries and why they matter in our daily lives and activities. Sprain is one of the most common joint injuries, often resulting from an abnormal displacement or twisting of the bones that form a joint. This sudden movement can tear ligaments, tendons, and other connective tissues that cross the joint. People who experience a sprain typically report pain, swelling, and a noticeable restriction in their range of motion. Sprains can happen during sports, daily activities, or even a simple misstep. Recognizing the symptoms early and seeking appropriate care is vital for recovery and to prevent further complications. Dislocations occur when the bones that form a joint are forced out of their normal positions. This injury is usually the result of a significant force, such as a fall or accident. The symptoms are often dramatic: visible joint deformity, intense pain, swelling, numbness, and a loss of movement in the affected area. Dislocations require immediate medical attention to prevent long-term damage. Knowing how to recognize a dislocation and respond quickly can make a significant difference in recovery outcomes. Bursitis is an inflammation of the bursa, a small fluid-filled sac that cushions bones, tendons, and muscles near joints. When the bursa becomes inflamed, movement around the affected area turns painful, and further motion can worsen the inflammation. Bursitis is often caused by repetitive, minor impacts or overuse, but it can also result from acute injuries. Recognizing bursitis early and modifying activities can help manage symptoms and prevent chronic problems. Arthritis is a broad term for conditions involving joint inflammation, pain, and swelling. It is commonly associated with aging, but can affect people of all ages. The inflammation leads to discomfort and limits the joint's range of motion. There are many types of arthritis, each with unique causes and characteristics. Early detection and management are key to maintaining joint function and quality of life for those affected by arthritis. Rheumatoid arthritis is a specific type of arthritis that stands out because it is an autoimmune disorder. In this condition, the body's immune system mistakenly attacks healthy joint tissues. This leads to inflammation and thickening of the synovial membranes, and eventually the breakdown of articular cartilage. The result is chronic pain, swelling, and progressive loss of joint function. Understanding the autoimmune nature of rheumatoid arthritis is important for both treatment and prevention strategy. Osteoarthritis is the most common form of arthritis and is classified as a degenerative joint disease. It is characterized by the gradual breakdown of cartilage, leading to pain, swelling, stiffness, and restricted range of motion. The exact cause of osteoarthritis remains unknown, but both excessive and insufficient mechanical stress on joints seem to contribute to its development. Managing osteoarthritis involves balancing activity and rest, maintaining a healthy weight, and sometimes medical intervention. All these joint injuries and pathologies have a significant impact on flexibility and movement. Sprains, dislocations, bursitis, and various forms of arthritis can limit a person's ability to move freely and comfortably. Understanding the biomechanics behind these conditions helps in developing effective prevention and rehabilitation strategies. By recognizing symptoms early and seeking appropriate care, individuals can maintain better joint health and mobility throughout their lives. Wrap up: joint injuries and pathologies such as sprains, dislocations, bursitis, arthritis, and osteoarthritis are common but manageable with the right knowledge and care. Prevention starts with understanding risk factors, practicing safe movement techniques, and responding promptly to symptoms. Regular exercise, proper warm-up routines, and listening to your body are essential steps in maintaining joint health. By staying informed and proactive, you can protect your joints and enjoy a more active, pain-free life.